So today I want to go over what is cupping therapy all about. My name is Dr. Chad Kuntz and I'm a sports physical therapist, and today we're going to talk about what is cupping therapy. Guys, it's a great way to loosen up tissue, to improve blood flow, and to decrease pain. What's kind of cool about cupping is that you can see and feel changes right away. To compare it to dry needling, a lot of times people are very sore immediately after doing dry needling. They might have an improvement like more range of motion, or they might even be a little bit stronger, but that soreness is there. What's kind of cool about the cupping is that you can feel like a sense of lightness or looseness and just overall decreased pain oftentimes right away. And so that's one really nice benefit of cupping. It is incredibly useful for muscles, so in the case of like tight muscles or knots. In fact, you can loosen up those muscles and it can even help nerves. So a lot of times the nerve's just irritated because the nerve can't quite pierce the muscle the way it needs to. So while you may not take the cupping right over the nerve, because I know some of you are grimacing at that, but you'll kind of go in the neighboring area, and opening up the muscles to decompress the area allows the nerve to breathe more, and it gets through. And a lot of times problems with nerves is that they're deoxygenated. They just don't have oxygen. They don't have room to rumble, so to speak. And so giving them more blood flow, getting more oxygen can really help that nerve health and decrease symptoms. Fascia too, we don't really think about that as often, but really tight fascia or poorly laid down fascia can be painful, and cupping is one of the only decompressive modalities that I know and use, compared to like even hands-on massage that'd be more compressive in nature. So cupping really helps free things up and would be useful for all three of those. And I didn't put it on there, but you could also arguably be useful for bursitis. So anytime that you have like a bursa that's irritated, it becomes bursitis. And I've actually found it anecdotally and clinically really useful for that as well. It's also a great detective for me. So it can detect areas of tightness, and it's kind of like this. I tell my clients, it's kind of like the idea of taking a vacuum over like a really thick carpet or rug, and what happens? That carpet kind of grabs it, all right? And so all of a sudden when you're moving that vacuum around, you can't move the vacuum as well as you want to, it gets grabbed. That's kind of what happens with the cup. And 10 out of 10 times when I'm moving that cup on their area of tightness or pain, they're saying something and I'm feeling it, right? They're saying, oh my gosh, like that's it. And I go, absolutely, because I can feel that it's not allowing my cup to move. And that'll be the area where we will focus to help continue to loosen up their tightness. Now I'm going to go ahead and show you guys a little bit of some video footage of what this looks like. If you'd like to listen in to more information, feel free to go to episode 17 on Prime Time Podcast. That's Pr1me Time Podcast. And I spent about 15-16 minutes talking you through that. All right, so let's get into kind of what this looks like. All right, so here I'm working it on their low back, and you can actually see, we gotta go ahead and pause it here. You'll actually see as I go down about right there. Okay, so you can see just above where the cup is, that's where it hurts the most, and that's where it's also reddest. Okay, that's where there's the most red, kind of that blanchy looking area. That's really a composition of histamines and blood flow, and so that kind of helps me understand exactly where we need to go. So I do find it very helpful. This is actually done on the lats, okay? So cupping can be done on the lats. The lats are a really big, tight muscle. They limit overhead range of motion, and you can see her, she's having fun with this. What you'll feel is kind of like a pinching, a pulling, a burning sensation. It almost feels like your hair is being pulled out, but I know it's not your hair because I've done this on a lot of women in areas that there aren't hair, and they go, man, I didn't know I had hair there. And I go, you don't. That's literally kind of being your fascia and tissue being opened up. So yeah, you will feel the symptoms. It doesn't feel amazing. However, the range of motion, the decreased pain, that's what we're looking for, and that's what we're achieving. So this was a case example done on the inner thigh. So as I mentioned, bursitis earlier, kind of that lower area around the knee, that's where the pes anserine bursa sits. So I'm literally following the gracilis and the inner hamstring muscle, the semitendinosus, all the way down, all right? And I'm also getting right to where the bursa is, and so it actually gets into some blood flow there. And a lot of times you'll see me, I'm putting the tissue on stretch, and then I'm kind of moving it, applying the force at the same time to make sure I'm getting all the locations that I need to. All right, so last thing here, I'm actually doing this on the thigh. So you can't quite tell from that position, but this person is in a stretched out position. That's something I tend to like to do. Just kind of stretch it out, and then I'll, again, move that, with some lotion up and down just to make sure that we're getting to all areas of accessibility and just making sure we're getting to all that too. So this is a great way to actually release the hip flexors, which is incredibly helpful. So if you guys have any questions, if that makes sense, and if you're interested about this, feel free to just shoot us a call. You could even text this number, and we'd be happy to kind of walk you through what this looks like for you if you're interested in it. And otherwise, I think that's it. Leave any questions or comments you have below. Have a great rest of your day.